My name is Dr.Priyanka Navale. I'm owner of Deccan Dental Clinic, which is located in Pune on FC Road. So today I'm discussing topic of trismus. So what is trismus? Trismus is a condition where a patient can't open his or her mouth to its full capacity. So normally when we talk about the normal mouth opening, so it is almost considered as 35 mm and more than that. If you're not able to open your mouth widely, then that condition is known as trismus. So in this video we are particularly discussing what are the common causes for the trismus and about the symptoms of trismus, and regarding the treatment plan we'll discuss it in the next video. That will be the part 2 where we'll be discussing the treatment part. So now just focus on what are the common causes of trismus. The first cause for the trismus is mostly it is related to third molar. Whenever your wisdom teeth are erupting, that time there is a condition called pericoronitis where the flap develop on the top of third molar while erupting, and it causes too much of inflammation as the upper teeth are continuously biting and on that flap, and that condition is known as pericoronitis. The inflammation sometimes spreads to the posterior part, and then it is very difficult for patient to open his or her mouth. That typical condition is associated with the third molar. Second thing, most of the time nowadays we see that third molars are it is very difficult for third molars to erupt normally in the oral cavity, since day by day jaw size is decreasing and the third molar, as we are not using the dentition to its fullest potential, that's the reason it's very common nowadays that the third molars are getting impacted. Whenever we do the disimpaction of third molars, that time it is very common after the surgery patient is not able to open his mouth. So that is one more cause associated with the trismus. Third condition is the oral cancer or a neck cancer, where particularly it involves the opening and closing muscles of the jaw. That time also most of the patient develop trismus. Along with that, I want to discuss the radiation therapy. Most of the time when for the cancers and all we do the radiation therapy, that time some fibrous tissue develops, and that is one more common cause for the trismus. Another common cause is the OSMF, that is oral submucous fibrosis. In such cases, because of some particular habits like tobacco chewing, betel nut chewing, there is constant irritation, constant source of irritation inside the mouth that causes fibrosis of the tissue or the mucosa, and which is again more common, like a common cause for the trismus. So these are the basic causes for the trismus. Now I just want to discuss the symptoms. What are the common symptoms? First common symptom, which is I'll say the main feature, is like patient is not able to open his or her mouth. That is the first symptom. Second thing, most of the time there is a pain in the jaw whenever patient is at a relaxed state or sometime doing particular movement. So during that particular movement there is sudden pain. That is second symptom, I'll say. Third thing, it is very difficult to perform certain movements which are associated with opening of mouth, like brushing your teeth, chewing certain type of food, biting on certain food stuff, as well as speaking and maintaining your oral hygiene. So these are the common activities which we do while opening our mouth, like bite on certain food items, clean our teeth, chew certain food items like pani puris and all. If patient is not able to open his or her mouth, how they are going to eat all such food stuff? So mostly the eating pattern will get affected, as well as the speech difficulty. There are certain words when we have to pronounce. If patient has a reduced mouth opening, then the speech difficulty will be there. So these are the common symptoms associated with trismus. So in this video we have discussed what is trismus, what are the common causes for the trismus, and what are the symptoms associated with trismus. Hope this video must have helped you if you are suffering from this condition, and must added some more knowledge to your information. Thanks guys, thanks for watching my video. Do like my channel, subscribe it. Bye bye, take care.